Welcome to this breathing practice, which is designed for people with back pain to enable you to breathe deeper into the lower belly. A lot of us do breath through the chest and not through the lower belly. So this is to get the whole rib cage to move. Our muscles from our back are attached to a lot of the ribs. So if the rib cage doesn't move, the back muscles don't move, we don't get our own internal massage, which no therapist can get that deep inside to be able to move those muscles for you. You need to move it holistically yourself, and a way of manage your back pain yourself. So we get an anterior tilt, a posterior tilt through the pelvis, and we allow the pelvis to move freely. We open up the pelvic floor and enable all those muscles through the pelvic floor, which come up through the diaphragm, and help the whole nervous system to regulate and to move freely. So let's take a comfortable seat, lying on your back. Make sure you're giving yourself time and quietness and a space that you can relax and switch off. So just have a little wiggle around on the mat. Make sure you're comfortable. Bend the knees. Maybe allow the feet to go out wide and the knees to drop together if that's comfortable for you. That will just allow yourself and your pelvis to open up a little bit on the floor and able to rest. Just pick the head up and lengthen through the neck. If the eyes aren't closed, close them down. And let's just take the tongue around the outside of the upper teeth. And then just relax the jaw. Just observing where your breath's at right now. Don't try and change it. Don't judge it. It is what it is. You are where you are. You're meant to be where you're meant to be. Just observe what it's doing right now. Try and just bring your attention on every exhale to your shoulders, allowing them to soften, relax. Okay, let's put the right hand on the lower belly, the left hand on the top of the ribs or wherever it's comfortable on the ribs. Try and keep your upper arms on the floor so you feel relaxed. You haven't got any tension through the body. Okay, we're going to inhale, and we're going to inhale using the chest first, and then we're going to inhale into the bottom hand. Now, don't worry if you're not getting the breath into the bottom hand straight away. If you've never done this before, it's not likely to happen on your first breath. So we need to relax the nervous system, relax the mind to allow that breath to reach the bottom. If you force it, your nervous system will react and shut it back down and have a reverse effect. So just allow it to happen in its own time. So we're going to take a breath in, feel the chest rise into the belly. Now the bottom hand's going to release first. So the breath out the belly, out the chest, back into the chest, into the belly, out the belly, out the chest, into the chest, into the belly, starting to expand a little bit, out the belly, and out the chest. I'm going to try and slow down the breathing a little bit. So we're going to slow going in, into the chest, keep pushing into the belly, a little bit more air, but nice and slow. Release from the belly. Relax the arms, the hands, the tension out the hands. Breath comes out the chest. Slower going in. Get used to the chest rising, the tummy rising, then when you breathe out, the tummy falling and the chest falling. So you're going like a bit like a wave. I'll leave you to do a few breaths on your own here. And do all the breath through the nose if you can. You will adapt to that. If you're not used to using your nose to breathe in and out, you will also find this difficult. It's a learning, it's a practice. You just allow yourself time to learn these practices. Don't just say, I can't do it, it's not for me. It needs to be for you. Everybody needs to do this. Breath is everything. Without the breath, we aren't anything. So let's make that breath nice and efficient. Slow down the breathing even more. And just relax. Just keep your eyes closed if you can. Just forget about your breathing a second. As I explain the next part, we're going to go back into what we were doing. Next time we're going to, on the exhale, at the very, very end of that exhale, we're going to try and pull the pelvic floor in. So like you're stopping a wee, and then you're going to pull your belly button to spine, and then you're going to just pull in and up. So your rib cage retracts as well as goes up and down, it goes back. So that's the bit that releases through the back and allows the pelvis to move. So imagine your pelvis like a big bowl of water. You're going to, as your pelvis tips forward, you're going to tip the water out. As your pelvis tips back, you'll tip the water backwards. Don't worry about that cue for now. Just you'll be aware of it when we get to that point. Okay, bring your hands back to your belly and your chest. Let's breathe into the chest, into the belly. Breathe out through the bottom hand, through the chest. As you get to the bottom of that breath now, start to pull the pelvic floor muscles in, your belly button to spine. You'll feel that diaphragm under that bottom rib cage, that muscle bit, feel a little bit tighter. As you inhale back through the chest, nice and slow, through the belly. And exhale. At the bottom of that exhale, at the very end, keep breathing out, pull the pelvic floor in, belly button to spine. Slow the breath coming in even more. Expand through the chest, the belly. As now the hands start to probably pull themselves apart a little bit, so you're getting a bit more space through your back and your mat. As you exhale, release the breath. As the back starts to round, the hands come together. At the end of that breath, pull the pelvic floor in, belly button to spine and up. Let those ribs drop and draw back, the back arches. Slow the breath in. Hands start to come apart, the back starts to arch, the shoulders relax at the back, relax the shoulders. As we exhale, allow that back to drop towards the mat, don't force it, allow the breath to lead your body. And the belly button comes to the spine, drawing the pelvic floor. Maybe a little bit of pressure through the feet to encourage that rounded over back. And you're ready to slow down the inhale, slow as you can. Breathe wide, breathe big, make your belly like a big balloon so your belly's soft. Shoulders start to come down, the back starts to arch. And the water tips out the front of that pelvis. As we exhale, the belly softens, the chest softens. The back starts to come to the floor, the hands together, gentle push of the feet now as you pull in the pelvic floor, belly button to spine. Hold the breath a little bit now if it's more comfortable at the bottom, and then slow in the breath as you inhale. The chest, belly, arching the back, allowing the water to tip out the front of that pelvis, arching through the spine, relaxing the hands, the shoulders. Get to the end of the breath, keep going, you've got more than what you think you have. Exhale, release through the belly, the chest, relax the face muscles, don't force anything. The back starts to round, the hands start to come towards each other. Gentle push with the feet, pelvic floor in, belly button to spine, diaphragm up. Pause. And you inhale again. Try and let that grip off your glutes. Allow your glutes to soften. Allow your shoulders to soften. As you're now like doing a lying cat-cow, as the back's starting to arch in and really mobilise. The more you can slow down this breath, the better. I'm going to be quiet now. You continue in your own time, trying to go through your cues, keep your mind focused on your practice. Your challenge is to stay focused and not drift off just because I'm not talking. Really focus your own cues. Learn to take ownership for your practice and do this yourself. Can't remember the cues, listen to your body. Your body will tell you what you're supposed to be doing. They'll come back to you if you give yourself space and time to think about it. Just going to do this for another couple of minutes. Trying to find more space through the spine. As we tilt that ball forward and backwards with the in and the exhale. Slow the breath down even more. Try and extend the breath. Get a nice full breath in. At the end of your next breath, don't rush this. You get to the end of the breath and then just let your breath go. But please don't do that until you get to the end of your exhale. Keep your eyes closed, keep your hands where they are on your body. Just observe your breath where it is now as normal when you get there. Don't worry, now your breath won't be as deep because you're not forcing it down. This is not how you're supposed to breathe in everyday life, but what this is, it's a bit like learning to crawl before you can walk. You won't better walk without crawling, you won't better breathe without practicing the breath. So this is for when the subconscious mind is kicking in and your automated system is breathing for you, and it will breathe deep where it needs to breathe deep. Slowly blink your eyes open. And then just allow yourself to roll onto one side and come back to seated. And just sit comfortably. You might feel now that you feel quite calm and your breath feels, your mind feels calm. When your mind and your breath come together, that's basically what calmness is. So it's good to do this practice daily if you can. The longer the better, maybe 20 minutes would be lovely. And also to have a marker of how you're progressing. So if you do yoga, you could do a reverse warrior and then a side angle and do it all with breath and really finding space and expand. Do it at the beginning, maybe do 3 at the beginning of each and then do 3 at the end after doing your breath work. And then you notice if the brain sees an improvement in your body, then you see success and then you're driven to do more. The other way you can do it is do cat-cow on all fours, just lifting the chin, lifting the tailbone, allowing the belly to be soft, and then rounding through the spine, and just see if you can get more movement through that movement. Anything that you struggle with in movement in life, test it, have a starter at the beginning, and test it again at the end so you see the results. Thank you for joining me.